Very good morning and good afternoon, everyone, and a very warm welcome to you all. So, I'm Dr. M. Shah Jaiswal, and on behalf of DBridge, it is my great pleasure to welcome you for today's webinar. So, today's webinar topic is exploring temporomandibular joint pain diagnosis and management. So, basically, this TMJ is one of the most complex joint in our body, playing a vital role in everyday function such as speaking, chewing, and facial expressions, etc. Yet, TMJ disorders often remain undiagnosed or misunderstood despite their significant impact on our quality of life. So, today's session aims to provide valuable insights into recognizing, diagnosing, and effectively managing TMJ related pain and dysfunction. So, now it's my great pleasure to introduce our esteemed speaker, that is Dr. Soya Xavier from India. She completed her BDS, MDS, and PhD in oral and maxillofacial surgery from Savita Dental College, and later she joined the same college as a senior lecturer and as a consultant at Savita Prime. She is currently preparing for professional examination and continuing her education in Germany. She has received extensive training in India and has made notable contributions to the field with a few publications in peer-reviewed journals. So before we begin, a quick note to all the participants that this webinar is being recorded and please keep your microphones muted throughout the session. Feel free to submit your questions in the chat box or Q&A box at any time, and we will have a dedicated Q&A session at the end of the presentation. So without further delay, let's begin the session. And Dr. Soya, this virtual stage is now yours. You may start now.
Thank you, Dr. Shreya, for the introduction. And it is an esteemed honor that I got a platform to showcase my presentation here by DBridge. And thank you for the opportunity. Without any further delay, I would like to begin with my presentation. So, a very warm welcome to everyone attending this seminar. So, the title of the seminar is Exploring Temporomandibular Joint Pain, the Diagnosis and Management. And as you all know, that temporomandibular joint is one of the joint which contributes to a lot of pain. And this particular joint attributes to pain in almost one third of the population. And as Shreya said, it remains undiagnosed, and people really do not know how to go about and treat this condition because they are not properly diagnosed. Yeah, like I said, temporomandibular joint is particularly divided into two things. One is the myofascial pain dysfunction syndrome, and the other is internal dearrangement. And when it comes to myofascial pain dysfunction syndrome, there are certain trigger points in your masticatory muscles which causes referred pain. And when it comes to internal derangement, it is related to the temporomandibular joint disorders, which relates to the articular disc of the TMJ, which results in the slipping of the articular disc, and because of which it results in pain as well as problems such as deflections and deviation in the joint. Now, coming to the cause of this temporomandibular joint, there are various causes, of which the most important cause is stress. Because when you have stress, it will, without fail, lead to temporomandibular joint pain. And even causes such as clenching, bruxism, and even a lack of certain vitamin, especially vitamin D, can also lead to a pain in your TMJ. And even sex hormones, progesterones, and estrogen plays a vital role in contributing temporomandibular joint pain. That's why this condition is quite predominant in women in older ages because they have a lack of these hormones. And the clinical features, like I stated before, clicking and popping sound in the temporomandibular joint is one of the most common clinical features that can be associated with this TMJ pain. And also pain in your masticatory muscles, such as your medial pterygoid, lateral pterygoid, and even your temporalis. And it is often associated with headaches. And there is jaw stiffness, which is leading you to the inability to open mouth. And sometimes you may even have shooting pain in your preauricular region. And also it causes malocclusion in some patients. Now, how does this particular pathophysiology of TMJ pain occurs? So when you have an excessive load on your temporomandibular joint, when I say excessive, that means when the load is more that it cannot deal with the adaptive capacity, what happens is that there is a dysfunction remodeling that is taking place in your temporomandibular joint, which leads to hypoxia. And when there is hypoxia, there is a release of various inflammatory mediators which causes cartilage breakdown and also that eventually results in temporomandibular joint pain. Now, before you come to the conclusion that the pain is temporomandibular joint pain, you have to exclude various other conditions which may give you a false positive idea that the pain is of temporomandibular joint origin. For example, if you have a common simple pulpitis, you may think that, okay, that is because I have temporomandibular joint pain. No, you have to be sure of the differential diagnosis before you come to the conclusion that the exact pain is because of TMJ. So the various differential diagnoses include pulpitis, and pericoronitis, and trigeminal neuralgia, sinusitis, and even sometimes ear pain can be also known as otitis media, can also be misdiagnosed as temporomandibular joint pain, and even parotitis, that is the inflammation of your parotid gland, which leads to swelling and even pain. So these two conditions are often misdiagnosed as temporomandibular joint pain. So, like I stated before, when you come to a diagnosis, you need to have a good case history taken. You need to know when the pain occurs, why the pain occurs, what is the duration of the pain, and where is the pain referred to, and does it have any other indications, or is your systemic health good enough so that you can have a good case history in hand. And with this case history in hand, you can come to a clear cut diagnosis. And when it comes to clinical examination, you have to explore and clearly see the various mandibular functions. For example, the mouth opening. If the mouth opening is restricted, that is, if it is, we say that your three fingers should be able to go into your mouth, then you have the adequate mouth opening. If that is restricted, then yeah, maybe you have some kind of TMJ disorder. And when your mandibular interferences is having some kind of problem, for example, deflection and deviation. So I'm I'll just explain what is deflection and deviation. So deflection is when you open your mouth, you see the deviation of your jaw. At the same time, the deviation does not come back to the midpoint when you're closing your mouth. That is known as deflection. And then deviation is when you open your mouth, but the jaw comes back to the centric relation, or when it comes back to the midpoint. That is when you have deviation. So when you notice such things in the patient, you can have an idea that that patient may be having some kind of problem with the temporomandibular joint. Next is the auriculotemporal nerve block. So auriculotemporal nerve has a direct innervation to the temporomandibular joint. So when you give a block to this particular nerve and the pain vanishes, then again, you can be sure that the pain is because of temporomandibular joint disorder. And when you give a dental block, and if the pain vanishes, that is also an indication that that pain is because of something related to the dental origin and not with that respect to the temporomandibular joint. And various muscle injections such as masseter or the trapezius muscle, that is your muscle here, which causes shoulder pain or so. So when you give injections to these particular muscle and when the pain goes away, again, you can be sure that it is maybe not because of temporomandibular joint, but maybe because of some other cause. So this is how you come to a conclusion that maybe that diagnosis can be attributed to a temporomandibular joint disorder. And also, there are various radiographic diagnoses available. One is our most commonly used is orthopantogram, that is the OPG. But in my personal experience, I would say that OPG does not give you a clear-cut idea whether you actually have a TMJ disorder or not. But a lot of people use it, and yeah, it gives an idea to some extent, but not fully. Then we have the CBCT, which will give you a 3D image. And if you want to see the soft tissue changes, for example, in your articular disc or so, then you will have to probably opt for an MRI, which will give you a clear idea about the disorder. Yeah, and then another new evolving technology is the T scan. So this T scan helps you to record the patient's bite force, including the various occlusal forces, and it helps to record the location and the timing. So then you are at the position where you come to know about the premature contact and how high the occlusal forces are and what are the interocclusal relationship between both the jaws. So accordingly, you can, if the patient has bruxismus or something like that, you can like trim off the cusp in that region and you can yield better results. Yeah. Next is joint vibration analysis. This is also something which is currently being followed in many countries where they make use of computerized technology to identify the noises made in the joint. So they have these vibration transducers called accelerometers, which are used to create characteristics waves patterns for diagnosing the various internal joint vibrations. So now I'll come into the management. Now, when I talk about the management, it basically deals with conservative management, and it is a multifactorial management that we are aiming at. So there are three things that you have to take into account. One is the psychological counseling. Next is the physical therapy, and definitely there are medications available for this. But for every patient, it is different. You cannot say that for this patient, this works, so it will work for the other patient. No, it is different for different patients, and you have to have a clear diagnosis and you have to formulate a proper treatment plan so that you can make sure that the management comes successfully or works successfully in each and every individual patient. And occlusal or orthototic splint is something that is used in majority of the patients which have a temporomandibular joint pain, and studies shows that it has yielded a good amount of result and a good amount of reduction on in the pain. So yeah, the first will be I'll be dealing with the psychological therapy, and psychological therapy aims at reducing your stress. So when your stress is reduced, there is a significant amount of reduction also in your temporomandibular joint pain. So there are various centers which exclusively offer various yoga therapies, for example, for treating for patients with temporomandibular joint pain. So you have to educate the patient, stating that how this particular component called stress is aggravating their temporomandibular joint pain and how they have to control it in order to have a good quality of life. And for some patients, we even advise dietary modifications where they are supposed to take only soft food and not like really hard food, because studies have shown that that also helps. And when I talk about parafunctional behavior monitoring and avoidance, I refer to bruxism. So there, the usage of splint can help to an extent in reducing the problem of bruxism as well as clenching. Biofeedback training is something that is new in the current field, where the patient is encouraged to assume a quite relaxable and comfortable position. And they have these electromagnetic myographic sensors which are attached to their masticatory muscles, for example, the masseter muscle, and their movements of the muscles are monitored. So over the time, they have an idea of how the muscles cause stress to their activities, and they have an idea on how they can promote themselves to reduce the stress because of the real time positive feedback which the monitor is giving them to them. So basically what I want to say is that the computer monitors and provides immediate feedback regarding the success in reducing the muscle activity. So after several training sessions, the patient themselves becomes aware that okay, when I do this, my muscle activity is more, so probably I should be a little more relaxed at this point of time. So when they do that, they are training themselves and they are becoming aware of themselves of what causes the pain and how they can reduce it. So this is something which is not very popular still, but studies have shown that it can cause a significant amount of reduction in various temporomandibular joint pain. And yeah, of course, physical therapy, which is being followed for a very long time. That is the coolant therapy using ice, or now in the markets, various cold and reusable gel ice packs are also available. And even the use of fluoromethane sprays have been shown to provide some kind of symptomatic relief. And even thermotherapy. Thermotherapy is the usage of heat on your joint, and they cause the vasodilation of the tissues. And when there is a vasodilation of the tissues, significant amount of pain is also noted. And then you have the transcutaneous electric nerve stimulation. So basically, when you yield to this therapy, what happens is that you have neovascularization happening. So when there is neovascularization, that means more blood supply, and as a result of which there is a little bit of reduction in the pain in the temporomandibular joint region. It basically makes use of low voltage and biphasic current of varied frequency. Then you have electrogalvanic stimulation. Here also, it is a principle of neovascularization that takes place, and also it helps to break the myospasm, and it increases, like I said, blood flow to the muscles, and thereby eventually leading to a reduction in the pain. Yeah, dry needling is something which is becoming quite popular in India these days. So here, what they do is, I have mentioned before that there are these trigger points in the masticatory muscles. So they target onto these trigger points, and we inject onto these trigger points. It is more or less same like the acupuncture technique. So when you are triggering these myofascial pain trigger points, so what happens is that there is kind of stimulation in that area. Thereby, it helps to reduce and regulate your neuromuscular pain as well as your movement deficits. So, for patients who have this fear for the needles, they can definitely opt for this low-level laser therapy, and it makes use of lasers in the wavelength between 600 to 1000 nanometer, and it is also commonly used in India. And now I can say laser is like very popular in India, and you use it not just for pain, for TMJ pain, but for even for various other fields. We can see that laser is commonly gaining its popularity. And for patients who have fear with needles, and also like in the dry needling technique, if they have fear for the needles, they can definitely make use of this low level laser therapy. So how does it work? It facilitates the release of endogenous opioids, and also it helps by tissue repair, and it enhances the cellular respiration, causes vasodilation, and thereby decreasing the pain threshold as well as the inflammation. So there is an improved microcirculation which happens when you are doing a low laser therapy, and thereby which all the hypoxic cells as well as the metabolic waste from your joint is removed, and thereby it helps to break the vicious cycle of pain as well as muscle spasm. Yeah, low level ultrasound therapy, low intensity level ultrasound. It makes use of sound waves with higher frequency, and this promotes in neovascularization and also in the differentiation of various mesenchymal stem cells, and also it promotes angiogenic factors that acts on these ischemic tissues and helps to improve the blood flow in those regions. So inotrophosis and phonophoresis makes use of these ultrasound technique to deliver medications into your temporomandibular joint area. Coming to pharmacotherapy, like I said, pharmacotherapy is maybe the most commonly used practice in India, where they make use of non-steroidal inflammatory drugs such as your commonly available sodium diclofenac, and we make use of muscle relaxants such as cyclobenzaprine and baclofen. And even for stress, we advocate the patients to take anxiolytics such as diazepam, and for depression, amitriptyline, and lidocaine patches, fentanyl patches are also slowly gaining popularity in the field of managing temporomandibular joint pains. Yeah, this is something new which is being again followed in India based on some studies, which states that if you give an intramuscular injection with diclofenac and vitamin B, it has a very superior analgesic effect than giving an injection of diclofenac alone. And also, the same applies for with the usage of propranolol, which provides a efficacious treatment for the pain management of TMJ, because it works through the blockage of the beta AR signal. So these are some new recent methodologies they are following so as to reduce the pain pharmacologically. So when none of these, so what I spoke before are the conservative management. When none of these conservative management works, then we go to a little invasive method, which is intra-articular injection, which involves injecting into your condylar space. So what are the various materials that we can use for injecting? They are platelet-rich plasma, which is known for producing hyaluronic acid as well as for very good cell proliferation. And it can be easily available while because you are just taking it from your patient's blood and you're centrifuging it and you're getting the product. And next is the ozone. The ozone, when it is applied in its initial or in its natural form, it has the capability of neogenesis, causing the formation of new blood cells in the region. And granisterone is nothing but non-selective serotonin receptor blocker. So it has been found in many studies that female with TMJ pains, they have a lot of serotonin receptors that are being indicated. So when you inject granisterone, which is an anti-serotonin receptor, it blocks these serotonin receptors and thereby helping in the reduction of pain. And then we have botulinum toxin. Botulinum toxin is basically a toxin which is obtained from Clostridium, and its function is by inhibiting the acetylcholine release and thereby prohibiting or inhibiting the vicious pain cycle. And even some people inject glucocorticoids diluted with local anesthetic solution into that particular area and thereby helping to stop the pain cycle. And yeah, so in the end, I would like to say that temporomandibular joint pain is a very serious disorder which affects the patient's quality of life because of the tremendous pain that experiences. And each diagnosis and diagnosing a temporomandibular joint pain is very important. Diagnosing it correctly is very important, and the management of this particular condition, it varies from patient to patient. So if one method doesn't work, you have to yield to another method so that it works for another patient. So because it is a multifactorial disease and the treatment is also multifactorial. So whenever you have a TMJ pain, do not ignore it, because over the period of time, it will affect your quality of life and you will have difficulty in leading your life normally. So the earlier you diagnose it and the earlier you treat it, the better your quality and the better quality of life you would be having. And yeah, that marks the end of my presentation. These are the few references that I looked into with the new methodologies that I had mentioned in my presentation. And yeah, that's it. Thank you.
Thank you, Dr. Soya, for that excellent and informative presentation. And for everyone who all are attending, so please continue posting your questions in chat box or Q&A box. We will take it later. And now I would like to share my screen and I would like to talk about our platform, that is dBridge. So basically our platform dBridge, it is an it is an integrated platform which is basically dedicated to bridge that global expertise with the local clinical practice. And we are Korea-based medical and dental platform that connects using your education and then community and clinically proven technology. And what we do is that we offer evidence-based education and webinars, doctor-to-doctor clinical exchange, curated medical and dental solutions for daily practice, and evidence-based information regarding Korean skincare and facial aesthetics. So basically, we deal with dentistry as well as the medical part, specifically the dermatological section. Then what is our vision? So here our vision is to democratize access to high quality medical education and technology, empowering every doctor to deliver safer and more predictable patient care. And our philosophy is learn, apply, and share. So we are proud to offer, unique opportunities for our clinical partners. And if you are showing active engagement with dBridge, so it will help you unlock the exclusive benefits such as, sponsorship opportunities, KOL collaborations, access to international speakers, invitation as a guest speaker at webinars and some conferences abroad. Then a special course discount. We are soon going to launch courses related to dentistry as well as regarding minimally invasive aesthetic section. So yeah, so it is subjected to applicable like terms and conditions are applied. And you may also explore our website. This is our website, and to access the education courses and our online mall featuring curated dental and aesthetic products. So here you can see we are also active across multiple social media platforms where we regularly share educational content, updates, and upcoming events. So these are some of our key highlights that we take pride that we have attended dermatological related conferences as well as dental related conferences across the world. And yeah, we also launched a few courses regarding the dentistry as well as regarding dermatology. And this is our dedicated team. We are small in size, yes, impactful in vision. And here are some of our global partners. And as this presentation was specifically about the TMJ, so I would like to talk about the Botox because we have Botox, as Dr. Soya already mentioned, that we can give it as an intra-articular injection, and it really helps in relieving the pain. So Botox is not specifically only for the, because it comes in our mind when we talk about Botox that it is basically related only to dermatology section, but no, it's you can use it in dentistry as well. It can be helpful in gummy smile, reducing block triangle, TMJ management, skin improvement, and as well as bruxism. So you need to, before injecting the botulinum toxin into your TMJ area, so you need to make sure that where you are going to put this, and you have to just make sure the targeted area and how many what are the doses and everything. And yeah, apart from that, we also have this Botox in dermatological section also, so I will not go in detail regarding the dermatology. And yeah, this is one of the Botox, which is now in our, it is available with us. So if you want to buy, you can DM us. And it is number one, like it is world's first vegan Botox so far. And it is basically generation 3. And yeah, this is regarding the dermatology, like all the approaches that how you are going to deal with it and what are the difference between the old Botox and this well stocks. So yeah, I will not go into detail. So yeah, I just wanted to say that if you want to buy and if you want to know anything about this Wellstock Botox, which is vegan Botox, so you can DM us. And if you want to, if you have any queries, or you may reach out to us via WhatsApp or email. And this is our feedback survey form. So kindly scan the QR code, and we will also send the feedback survey form via email. And it will really help us to improve and prepare for the next webinar of your interest. And yes, certificate will be issued when you complete the survey. Yeah, thank you. That's it. And now we will take questions. So I have also collected some of the questions using Google form. So yeah, first question, let's take that question first. So first question is that artificial condylar prosthesis. So doctor, would you like to comment regarding artificial condylar prosthesis?
Artificial condylar prosthesis is something that you use when you have a really big TMJ deformity. For
Hmm.
example, if you have a TMJ ankylosis and you have resected the mass, and then you want to fill the gap in between, you use these artificial condylar prostheses. And then sometimes when you have severe gross deformities in that area, then you want to replace the gap, you make use of these artificial condylar prostheses, and they are custom made available in prefabricated size. And sometimes you can even design them how you want with the help of CAD/CAM technology. So the advantage of this particular appliance or these particular prostheses is that there is reduced donor site morbidity, because you don't have to take the bone graft from another region, you're getting the processes in hand. So there is reduced donor site morbidity. The disadvantage, and you can have like a really good movement function of your jaw is like comprehensively increased. The disadvantage would be probably the risk of infection, and it is right now a little bit costly, so the cost factor should be considered before you opt for this particular treatment. And yeah, it is mainly made up of polyurethane fluorine, if I'm not wrong, it is made out of that. And yeah, the only disadvantage is the risk of infections and also the cost. So if you can overcome that and make use of this, then yeah, it is a good option. But it is not for any TMJ pain. It is for a little bit advanced stages like ankylosis, or when you have resected the condyle in that region because of any tumor or so, then we
Yeah.
make use of this particular
Yeah, if
process.
you have any congenital deformities also, then you can go for it. So I think basically I would like to add that uh, you need to select, like you need to select the patients very carefully in this
Yeah,
matter, because it is
yeah.
the this is a last option, you can say. And as
Mhm.
Dr. Soya said that if you have very severe deformities or severe thing related to TMJ, then only you can go for this. And apart from this, you also have to go for the conservative treatment hand in hand. So yeah. And then second question is, how can a fresh BDS graduate improve clinical skills, find the right job opportunities, and build a successful career in dentistry? How can I prepare for dental clinic interview as a fresher? Well, this is not a relevant question, but yeah, if you want to add something to this, Dr. Shreya, go on.
Okay, so as a fresh BDS graduate, I would recommend you to initially focus more on gaining an experience and not looking for the financial part of it,
Hmm.
because I have seen a lot of BDS graduates, they take up jobs in clinical clinics also just to earn an amount, because they have finished their BDS and they want to start earning, so they keep doing that. So that is a practice which I would ask to refrain. So what you can do is keep updated with the knowledge, keep attending various webinars, like the one dbridge is providing various webinars, and keep yourself updated with what is currently happening in dentistry, and how you can be aware of the new technologies and the new treatment innovations that are available in market. And try to document all the cases that you're doing, like with proper photographs and proper post-operative radio intraoperative and post-operative radiographs. And so try documenting each cases that you do. And also try to improve your soft skills, like for example, like maybe team skill management and how you have a patient doctor rapport, all that, try to improve a little bit. Don't look for the financial gains in the first few years, just try to gain experience, and then later on it will slowly come. It's a process, it will slowly fall into place.
Yeah, yeah, she is totally right. And I would say that never hesitate to ask questions. If you
Yeah.
ask question, you will gain more and more knowledge from it.
Hmm.
And observe very carefully, right? If
Yeah.
any you are under any experienced dentist or clinician, so observe them, how they are doing, how they are managing, how they are establishing the good rapport with the patient. And how you are going to, if any patient is not satisfied with the treatment, how you're going to handle them. So these things you need to take into mind and into consideration. And apart from that, I would say that for improving your skills, you can take the webinars and seminars, as she said, hands-on sessions also. And
Mhm.
IDA plays a very important role as well, because they serve a lot of courses. So you can just join the courses from IDEA as well, and you can learn a lot of things from there. Yeah, and next question is that, how to differentiate between MPDS, TMJ disorder, and cervical issues clinically?
Yeah. So MPDS, if you look into that, in MPDS, you have these particular trigger points in your masticatory muscles. Whereas in TMJ pain, you don't have that. You just have like some problems with your temporomandibular joint, which deals with, there is maybe deflection, deviation, clicking or popping sound. And with cervical issues, you have pain in your cervical region, which is unexplained, but you have pain there.
Hmm.
That is one way you can see it clinically. And then in MPDS, patients tend to have temporal headaches, whereas in these cervical pain, it is mostly occipital headaches that they have, which means that they have pain in the back of their neck, in the base of the skull region. They have really they experience a lot of pain. And also in cervical pain, I think your cervical motions will be restricted because of the pain, and that you don't observe with MPDS as well as with TMJ joint pain. So that is one way I would say clinically how you can diagnose these three conditions: MPDS and TMJ pain, and also the cervical pain. Clinically, yeah, these are the most useful tools which can be used.
Yeah, so I would like to add a very quick way to remember it, right? M starts MPDS. It starts from M, so it will be M. That is muscle. If you're palpating muscle and if you're feeling pain, it is MPDS, right? Regarding the TMJ pain, as she said, that if there is any preauricular pain or any joint sound or any locking sound is there, so it within a quick fraction of second you will come to know that it is TMJ related pain or disorder. Talking about the cervical, so it will restrict your neck movement as well. Especially, you will have a very stiffness into this SCM, that's the sternocleidomastoid muscle, as well as the trapezius muscle. You will also have the shoulder pain, and as she said, you will also have occipital headache too. Yeah, so this was from the Google form. Now let's see if there are any questions over here. Um, yeah, there's one question from Nishan P. Hi, I'm a recent PDS graduate. I find myself difficult to differentiate between TMJ and cervical issues. How can I differentiate clinically? Yeah, we already discussed about it. Next question is that are there any app available in India currently for TMJ or TMD patient diagnosis, treatment planning, monitoring, and treatment solution?
Yeah, in India, there is an app which we suggest to the patient. It is called as My TMJ Track. So in that particular app, it reminds you to do these guided exercises. It
Mhm.
not just reminds you, but even it shows you how we can do these particular kinds of exercises. And also, it gives you reminders to take your medication, and even your psychological stress on how to meditate a little bit so that you can avoid the pain in that particular moment. So it is not very popular as such, but slowly doctors have started giving out this app which is called as My TMJ Track. So that is one app which is available right now in India, and which quite a few of patients are making use of this app, and they are promoting it and using it.
Okay. Uh, so yeah, our CEO, she has told that there is also solution from Korea regarding the app. If anyone is interested in testing it or doing any sort of research with that app, so let us know. We will be very much welcoming to like regarding the research field. And yes, next question is that from David, when exactly is an operative therapy necessary for TMJ dysfunction? Should it
Mhm.
be recognized and treated much earlier?
Okay, that is a very good question. So, mostly operative therapy is never the first-hand therapy when you are talking about a temporomandibular joint dysfunction. Mostly 80 percentage of the people get themselves better with just conservative management, which like I have discussed here, with psychological therapy and with the use of splints, and also with controlling that food, which is not so hard food, when they try to control that and controlling their bruxism. They have an idea and they can get hold of the condition, and they can get it treated with just the use of conservative therapy. But if you are talking about surgical intervention or operative therapy, the various options available are arthroscopy or arthrocentesis, on sometimes even like we discussed the total prosthesis joint replacement, that is also available, but that is not really necessary until and unless it is at the end stage.
Mm.
So, like I said, the earlier you diagnose it, should it be recognized and treated much early? Yeah, it should be recognized and treated much early, because the earlier you diagnose it, the earlier you get the
Rid of
treatment,
that
and the
disease.
earlier
Yeah.
you can improve the quality of your life. So yeah, and surgical intervention, we try to avoid it, and we perform it only when it is a absolute indication, and not in all patients. Only when we see that, okay, yeah, it is like really really bad, then yeah, then we go for the surgical interventions.
Mm. Okay, that's all. Okay, so yeah, as we come to the end of today's webinar, so again, I would like to extend my sincere thanks to Dr. Soya for taking time from your busy schedule. I know you are busy nowadays, but thank you so much for your valuable insights into the diagnosis and the management of the TMJ. And also, next, I would like to thank Ms. Lena, CEO of DBridge, for providing this platform to us. And at last but not the least, obviously, our attendees for their valuable participation. So, this overall, today's webinar, it highlighted the importance of early recognition, accurate diagnosis, and then treatment approaches. in improving patient outcomes and quality of life. So, yeah, that's all. We hope you find this webinar informative and beneficial for your professional practice and continued learning. So, please take a moment to complete the survey that we shared, and I will also send it again via email. And then, yeah, your feedback really helps us to improve future educational programs. So, we look forward to welcoming you to our upcoming webinar and educational event. So, until then, stay safe, healthy, and keep spreading knowledge and continue to embody our motto, that is learn, apply, and share. So thank you everyone and have a wonderful morning and evening. Yeah. And have a nice weekend also. Okay. Bye.
And I would like to extend my thanks to the CEO of Dr. Bridge,
Yeah.
D Bridge, I meant,
Great.
for giving me this platform to show and give my presentation here, and also to you, Dr. Shreya, for conducting and hosting this presentation in a really peaceful and a pleasant manner, and also to the audience who kept the uh, webinar very lively.
Yeah.
Thank
Thank you.
you.
Thank you. And good luck for your future endeavors. We will be in touch. Thank you.
Okay, thank you.
Thank you, everyone.